Good afternoon, everyone. My name is Maya Luria with TMC for Seniors, and today we're going to learn all about what you need to know if you have a hearing issue. I have with me Haley Lanoue and Karla Navarro. They are both audiologists with TMC Audiology. Welcome.
Hi.
So what we're going to do is Haley and Karla have put together a presentation. They're going to share with you everything about hearing issues. And afterwards, if you have any questions, please leave them in the comments, and I'll be happy to ask any of those questions to Haley and Karla afterwards. So I'm going to go ahead and turn the stage over to you ladies.
Thank you. Thank you. All right. So thank you for that introduction. I am Haley Lanoue. I'm one of the audiologists here at TMC. We're located on the third floor of the Atrium building, which is located on the corner of Grant and Rosemont. I primarily work with adults with hearing loss and patients with both tinnitus and dizziness and balance problems.
Hi, my name is Karla Navarro. I'm also an audiologist. I'm actually located at the Atrium, and I work with patients from birth throughout the lifespan, primarily with diagnostic testing, but also do provide hearing aid and cochlear implant services.
And there's also audiologist Shauna Bone as well, who's been here a very long time and works with patients of all ages as well.
So today we're going to cover several topics, primarily what are the signs of hearing loss, how do you go about getting your hearing tested, what to look for, and then we'll talk about some communication strategies, and I think we'll leave some time for questions as well, so just put them in the comment box and we'll make sure to get to them.
Next. So we're going to start off with signs of a hearing loss. So I want you to maybe take note of if you answer yes or no to any of the following questions. So do you find yourself, or do you experience that you are often asking others to repeat what they say? Or are you saying huh or what frequently? And do you feel that other people are mumbling or not speaking clearly? Do you have difficulty hearing certain voices, such as women or children? And can you hear speech happening but have difficulty understanding it?
So other signs of hearing loss may be that you're missing out on words or phrases when you're listening to someone talk over the phone, television, or radio. You may also be finding yourself turning up the volume on television or radio to a point that it's louder than what is comfortable for others around you. You may also find that you have difficulty hearing but not understanding when you're in a noisy environment, such as a group gathering or at a restaurant or grocery store type of setting. Lastly, you may also find that you have difficulty following conversations when there's more than one person involved.
So, do you experience any of the following? Are you hearing better in one ear compared to the other? Do you have fatigue after difficult listening situations, like after going to a restaurant, you're just exhausted from having to hear everyone? Do you have any pain or pressure in your ears? Or do you have any ringing, buzzing, chirping, or other sounds, either in one or both ears or in your head, which is called tinnitus?
So we figured we may not only be reaching out to people that possibly have a hearing loss, but also people that may know someone with a hearing loss. And so some signs that someone you know may have a hearing loss are that you find yourself having to raise your voice or move closer for that person to hear you, that you may feel like the person is ignoring you or inattentive when you're speaking to them. You may also notice that the person's responses to what you said or what you asked are off topic or don't make sense. Another sign is that that person may dominate the conversation, because that means that they have to take less turns listening and possibly misinterpreting what you're saying. Another thing that you may notice is that that person may turn up the volume on the TV or radio to a point, again, where it's louder or too loud for people around them.
And if you answered yes to one or more of the experiences above, it's time to schedule a hearing test. Those can all be signs of a hearing loss or a hearing problem. And so we recommend you getting your hearing tested.
And to schedule an evaluation, you will require a referral from your primary care provider. And once we receive that referral, our scheduling department will be contacting you to schedule the evaluation.
So how often to test your hearing? We always recommend, if you notice a sudden change in your hearing, definitely schedule as soon as possible, within that week at least. If you notice any of the signs of hearing loss that we just went through, either for yourself or someone else, go get a hearing test. It is recommended after the age of 50 to have your hearing tested about every 3 years to monitor your hearing. And then we recommend annual hearing tests if you do have a known hearing loss, or if you're exposed to loud noise either recreationally or occupationally for work. And so why that often? It does seem like that's a pretty frequent time to get your hearing tested. And that's because hearing loss is the third most common chronic condition in globally, not just the US. 1 in 3 people over the age of 60 have a hearing loss, and that goes up to 1 in 2 people over the age of 85 have a hearing loss. Hearing loss often occurs gradually, and those signs of hearing loss might be really subtle or missed entirely. So it's important to monitor that pretty regularly. Untreated hearing loss has been linked to social withdrawal, sadness, depression, and is a modifiable risk factor for cognitive decline. And so those are all important reasons to get your hearing tested as frequently as we recommend. But treating hearing loss and knowing that you have a hearing loss can improve your quality of life and ease your overall communication with the people around you.
So we're going to go ahead and go through some anatomy of the ear to help you understand how we hear, and therefore also be able to understand hearing loss. So there are 3 major parts to the ear. We've got the outer, middle, and inner ear. What you see here is the outer ear. So you've got the pinna, which is the part that we can see. It's also composed of the ear canal and the eardrum. And so the pinna serves like a funnel to trap in the sound and allow it to transmit through the ear canal and to the eardrum. The eardrum then moves back and forth following the motion of the sound wave. And then we go into
Next slide.
the middle ear.
So now we have the middle ear. That eardrum vibrates, and it vibrates 3 bones in your middle ear. Those are some of the smallest bones in our whole body. It's a little air-filled space, and those bones are responsible for amplifying the sound so that it can go through the rest of the system. This middle ear space is also connected to your sinuses through something called your eustachian tube. So that's responsible for maintaining the pressure equalization. So that's what you kind of feel pop when you go over a mountain pass or you're coming down in an airplane. And again, that's an air-filled space, and those bones help amplify the sound that you hear.
So once the sound travels through the outer and middle ear, it reaches the inner ear. And the inner ear has 2 major components. You've got the vestibular system, which is critical for balance. And then you've got the cochlea, which is that snail-like shape that you see there. And that space is actually filled with fluid. So when the energy goes from the middle ear space into the cochlea. That fluid is in there, moves, and it's converted into electrical energy that then is transmitted to the auditory nerve and to the brain.
So once that sound goes all the way through that outer, middle, and inner ear, those electrical signals made by the inner ear sends that information to your brain. So once you hear the sound, your brain is responsible for figuring out what that sound means, how that pertains to you, and what your response might be. So your ear helps you hear, and your brain is responsible for the understanding.
So because there are separate parts to the ear and any of these different parts could have a problem, there are also different types of hearing loss. So the type that we're seeing here is a sensorineural hearing loss, meaning that it's a hearing loss that's affecting the inner ear. And so this is the most common type of hearing loss that we see because it is related typically to noise exposure or age-related deterioration of the middle ear. And so this tends to be a permanent hearing loss. We've also got,
there's another type of hearing loss called conductive hearing loss. And so this is something preventing the sound from getting down to that inner ear. So again, this is where that sound is being amplified in your ear, and then the inner ear is sending the signal to your brain. So if sound is not getting down to the inner ear, it's going to give you a hearing loss. Common causes are things like earwax blocking that ear canal, something like an ear infection or getting fluid, middle ear fluid, maybe from a sinus infection or cold, can prevent that sound from getting down. There's a number of possible things that can prevent that sound from getting down. So this is one type of hearing loss. Oftentimes, this can be treated medically, and so we'll look for if there's any signs of a conductive loss.
and lastly, there is a mixed hearing loss, which is a combination of sensorineural and conductive hearing loss. So an example of this may be something as simple as earwax that's blocking your ear canal, and so you may have walked in with a mixed hearing loss. Once we get the earwax out, we may get rid of that conductive component, but there may still be a permanent or sensorineural hearing loss that's resulting from, say, aging or noise exposure.
So this is a graphic kind of demonstrating the difference between a conductive loss and a sensorineural loss. So a conductive hearing loss, something blocking the sound from getting down, is going to generally make everything just softer. So it will still be clear because that nerve and your inner ear are working well, but everything comes in a lot softer. And so it needs to be amplified in order for you to hear it like normal. Whereas a sensorineural hearing loss, everything is going to both be softer and also less clear because there's damage to those sensory signals being sent to your brain. So often people with a sensorineural hearing loss will have problems with the clarity of speech or the understanding of speech. Whereas someone with a conductive hearing loss, once that sound just gets loud enough, they hear it great. A sensorineural hearing loss, even if it's really loud, you might still have difficulty with that clarity.
And so what to expect at your hearing test or evaluation. So we typically start out with a case history. We want to know, if you've got a history of noise exposure, any problems with your ear, nose, or throat, since they're all related. The actual testing involves otoscopy, which is simply looking at and examining your outer ear, your ear canal, and your eardrum. Then we proceed with something that's called admittance testing. You may also hear it referred to as tympanometry, which is part of it. And so essentially this is looking at how your eardrums are moving. This can tell us about the status of the middle ear. Is there possibly fluid there? Is there possibly an ear infection? And then we also look at reflex of the middle ear. Following this, we start with the hearing test where you're actually participating and responding to the different stimuli. The first part is pure tone testing, which is done under earphones, and you'll see that there's different kinds of earphones, ones that go in your ears, ones that go over your ears. And then we also do bone conduction testing. So that's a headband that is usually placed behind your ear, and so that bypasses that outer and middle ear that we just reviewed, and it directly stimulates the inner ear. And so with the pure tone testing, what we're doing is trying to find the very softest level that you can hear several different pitches at. Then we also do typically include speech testing. So this is presenting single words to you out of context with no visual cues at a level that is comfortable for you. And we're looking at how well you can understand those words.
And so all of that testing, we as the audiologists are going to be looking for mainly these four things. What type of hearing loss it is. So is it something going on in your outer, middle, or inner ear, or multiple parts? That conductive, sensorineural, or mixed hearing loss. We're looking at how severe it is. So how loud does the sound have to be before you can just barely hear it? We're looking at the configuration, which refers to the shape. And so we look at the different pitches that we presented to you and how well you can hear at each of those pitches. Most often, someone will have what's called a sloping hearing loss, and we have an example of that for you later. And then we're also lastly looking at, are your ears working together or are they working separate? And so all of those will help us determine what we're going to recommend for you.
So here we have what's called the audiogram. This is the graph that an audiologist uses to plot each of those responses that you gave us to help determine the very softest level that you could hear at all the different pitches used. So the pitches are listed across the top from left to right. You've got low to high squeaky squealy pitches. So this is not referring at all yet to volume. This is just the quality of the sound, the pitch. On the vertical end, you've got the volume or the level. So higher up on the graph is soft, lower down on the graph is louder volume. So you can see the area there that is lightest is the range of normal hearing. The red symbols are the right ear, and the blue symbols are the left ear. So we have the different severities listed here. And in this case, like Haley said, we have a sloping hearing loss, which is the most common configuration that we tend to see, particularly when it's hearing loss due to noise exposure or aging. We tend to see those higher pitches affected first. And so a lot of patients tend to have normal hearing in the low pitches or a milder degree of hearing loss in the low pitches, and then you start to see that slope. So here we see a symmetrical hearing loss, meaning that it is equal between the right and the left ear. And it's in the normal range in the low pitches, and then it slopes from a mild to severe hearing loss in the high pitches.
So this picture is that same hearing loss that we just saw, and overlaid on it is what we call the speech banana. So the black outline that you see that kind of looks like a boat, that represents the average speech sounds in the English language when spoken at an average level. So someone talking at a normal level about 1 meter away is what represents the average speech sounds there. So like Karla said, anything on the top of, there's normal hearing on top all the way up to a profound hearing loss on bottom. And so anything that's above that sloped line is anything that you can hear. Anything that's below is not audible to you. I mixed those up. So anything below is audible, anything above is not audible. So again, this is a common type of hearing loss that we see, where those high pitches near underneath the 2 and 4K up on the top there, those are the high pitches. Those would not be audible for this person's hearing loss. That's often the consonants or clarity of speech. The low pitches make up most of the volume and the vowels of speech. So this person would probably come in and say, I can hear that speech is happening, but I can't understand it, because they're hearing the volume or the vowels that carry kind of the oomph of speech, but they're not hearing those important parts of speech that make up the meaning of words.
Okay, so you've come in for your evaluation, you've got your referral, and now, so what do we do next? Well, that's going to depend on your hearing loss and your self-report on how this is affecting you. So one of the most common recommendations that we make is amplification, and that can include traditional hearing aids, cochlear implants, or bone conduction hearing devices. So this will be determined by the degree of hearing loss that you have and the type of hearing loss that you have. Sometimes you may require a medical clearance from an ear, nose, and throat physician before you proceed with traditional hearing aids. Other times you may be able to proceed with them right away. We typically schedule you for a hearing aid consultation 1 to 2 weeks out, and we sit down and talk to you about your options, and then have you come back for a fitting. We'll go into a little bit more detail about that when we talk about hearing aids. With a cochlear implant and bone conduction hearing devices, you definitely need to have an ear, nose, and throat physician involved. So those will be our most common recommendations usually. Other times we may recommend just hearing protection depending on the degree of hearing loss and the person's lifestyle. If it's someone who's often exposed to noise, then we definitely will recommend hearing protection. Use of communication strategies is another recommendation that we often make, and that's regardless of whether you're pursuing hearing aids or not. So I do believe that communication strategies can be beneficial to people even with normal hearing, because we all find ourselves in situations where it's too noisy and it's difficult to hear. So again, we'll go into more detail about communication strategies in a bit and tell you what are some things that you can do to help you do better in those. Okay, so amplification. So on the top right there, you see some pictures of different styles of hearing aids. There are styles of hearing aids that are custom made and go completely in the ear and are a single piece. Then you have other hearing aids that are a bit bigger, can have 2 pieces, one that goes in the ear and that one that sits kind of over and behind the ear. So the style of hearing aid is determined by you and your audiologist. It depends on your hearing loss and your lifestyle and needs and wants. Some are ideal for different types of hearing loss, so we would review all of that with you. Again, we schedule a hearing aid consultation where we go over the different styles, pricing, different technology levels with you, and we try and pick what's most appropriate for your hearing loss, your lifestyle, and what you would like to have, as well as your budget. Overall, the idea is that hearing aids will help improve or increase the audibility of soft sounds and speech that you're not currently hearing, because they will be programmed to your particular hearing loss. They will also prevent loud sounds from causing discomfort or further damage to your hearing. And overall, they're going to improve your quality of life, but it is important to mention that you have to work very closely with your audiologist, because it's not going to be all said and done after your first fitting. You should be coming back for hearing aid follow-ups so that adjustments can be made accordingly.
So hearing protection is something we recommend for anyone that is going to be exposed to loud noise. So noise exposure does lead to hearing loss. The louder a noise is, the more likely it is to damage your hearing. Noise exposure is additive over our lifetime. So if you listen to a ton of noise when you were 20 years old and you keep listening to a ton of noise throughout your life, you're more likely to have more hearing loss from a bit more noise exposure than if you were to never be exposed to loud noise before. On that right side is kind of a thermometer. I know it's not the easiest to read there, but the low green 0 level is what we consider the completely normal hearing, no impairment in your hearing whatsoever. And then as you get up, the sound gets louder. Around 55 to 60 decibels is what we consider average speech, again, from about 1 meter away, one-on-one. 85 decibels is kind of the marker of sounds getting to the too loud category. So that is considered like a busy, you're in the middle of a city with a lot of traffic going on. That's about that loud. A little bit louder, we get into a hair dryer, a lawnmower. The louder it gets, we get more into power tools. And then the loudest sounds that you see up there are things like a jet engine and a shotgun or any guns used for anything. It is recommended by OSHA, the CDC, everyone basically, that if you are around 85 decibels of noise for the time period of 8 hours, you're required to wear hearing protection at your occupation, but that's also recommended if you were to go to a concert or something as well. And the other graph that you see with all those numbers, as the number increases, so as the level of sound gets louder, there's a shorter duration that you can be around before it's likely that you will develop hearing loss. So if you are going to be doing yard work all day or working with power tools all day, or even for just a couple hours, you really want to be wearing hearing protection. Or if you're shooting a gun for even just one shot, you definitely want some hearing protection on. There's the foam earplugs that if you're using those, it's important to roll them up really small, pull your ear back and push them all the way down into your ear, and then let them expand completely before you go into the noise. There's over-the-ear hearing protection where you just have to put that on and it gives you a really good noise protection. And then there's custom hearing protection. So you can get earplugs made specifically for your ear canals. They just slide right in and they fit perfect for your ears. At TMC, we do offer custom-made hearing protection for you. And you can get different filters for different scenarios. So maybe you're using them for hunting or shooting, in which case we want a lot of hearing protection. Or maybe you're going to a concert where that filter is going to filter out all of the sound equally to you, so you still keep the sound quality. Everything is just softer for you. And so at your hearing test, we can always talk about those options with you.
Okay, so on to communication strategies. So we do believe that communication is a two-way street, and so we actually split it up into strategies that are recommended for the listener and strategies that are recommended for the speaker. So we'll go into those in a bit as well. For the listener, whether you have a hearing loss or not, I think it's important to be facing the speaker to reduce noise when possible. Maybe if you're at home washing dishes or watching TV, if you can turn it down or turn it off, that would be ideal. This goes along with minimizing distractions or multitasking. If you're in the middle of washing dishes and someone's talking to you, if you can stop that for a second and have the conversation, that tends to help. If you do have a hearing loss, then advocating for yourself and letting the person know that you have a hearing loss or are having difficulty hearing them is important, because oftentimes what we tend to do is simply say what, or I didn't hear it, what did you say, rather than letting him know that it's not because we weren't paying attention, but because we're actually having difficulty. Asking the speaker to rephrase what was said is also important. Again, going back to simply saying what, huh, because those words tend to frustrate the speaker because it appears to them as though you're not giving them your full attention. So if you catch on to some keywords, make sure to use them. If someone's telling you about, say, for example, running into someone at the grocery store, and you caught grocery store, well, you could say, what did you say about the grocery store? That way they know that you are listening with intent and simply having a hard time hearing them. You can also remind the speaker to slow down. Oftentimes when we tell people that we're having trouble hearing them, they tend to speak louder, but that also sometimes means faster. And so slowing down can really help.
And then for the speaker, so if you're talking to someone who has a hearing loss, or if you're talking to someone and you just notice that they're not hearing what you said correct, make sure that you always talk while in the same room. So this goes back to facing the speaker. You want to face the listener. One, because you want to get their attention. If they don't know that you're talking to them, they're not going to realize that you're talking to them until you're already done with your sentence, and they're going to have missed everything. So get their attention, be in the same room, face the speaker or face the listener so that your voice is being projected to them and not somewhere else. Reduce the noise. Again, pause or mute the TV, turn off the faucet. Anytime that you reduce noise, you're going to have a better time with the communication. You're not competing with the noise. It's a lot clearer. Speaking slower often automatically makes you speak clear. So some people will ask you to speak clearer or stop mumbling. Speaking slower helps with that rather than speaking louder, because like we mentioned, louder doesn't always mean clearer, especially for someone with a sensorineural hearing loss. Rephrasing what you said rather than repeating. If you just repeat it over and over, they're going to miss the same thing over and over. If you say it in a different way, there's a better opportunity of getting more information. And then making sure to confirm important information or even writing it down if needed. So I think of this one especially at like a doctor's office, making sure that you repeat back or have them repeat back so that you make sure you're on the same page. And if communication is really breaking down and it's important information, write it down on a piece of paper, text it out, something to make sure you're both on the same page with each other.
And I think one that just came to mind and we forgot to add on there is a common, very difficult situation is at a restaurant, and it's not always possible, but when possible, choosing an area that's well lit and having, if there's the possibility of sitting like at a booth, for example, having the person that's talking to you sit up against the wall or the booth, and the person with hearing loss on the opposite end. That way the person who's the speaker is not having any competing sound going against the level of their voice. And so, go ahead.
Yeah, and on that, if they are wearing hearing aids, if the person with hearing aids is positioned with the noise behind them, those hearing aids are going to do better at reducing the background noise if it's behind them than if they were facing all of that noise as well. Mm-hmm. Hearing aids can never completely eliminate background noise, but that will give you the best opportunity.
Yep. Very good. And so remember that to come see us here at TMC Audiology, you do need a referral from your primary care provider. We typically will reach out to you once we get that referral, but if you have any questions, you can call us at 324, that's area code 520-324-1055. And make sure you pay attention to the address because we're not on the main hospital campus. It's a separate building on Grant and Rosemont.
Yes. And then we have some community resources here. So we are a great resource here at TMC, but sometimes you need support from other people in the community. So we have listed those. That first one, Living Well with Hearing Loss, is a group class by the University of Arizona. And it is a group class, I believe they're online at the moment, for you to work with a communication partner, working through those communication strategies, really working together in a group setting to make sure that you are comfortable advocating for yourself and using those communication strategies. U of A also has the Sertoma Hearing Aid Bank through the Community Outreach Program for the Deaf. They have affordable hearing aids. So hearing aids can be expensive, and if they're not covered by insurance, that is one resource for you to be able to get a hearing aid. The Grace Hearing Center also is an affordable resource for hearing aids, and they have sliding scales with community service available. Aloha is Adult Loss of Hearing Association in AZ, and they meet for oral rehabilitation, so using those communication strategies, working with your hearing loss. They have group meetings, so group support meetings for people with hearing loss. And they have various resources through there, even resources for things like assistive listening devices, which is instead of a hearing aid, maybe something that you wear headphones to amplify sounds in certain situations. And then vocational rehab can be a good source if you are working still and you need hearing aids to be able to complete your job. They can help you get hearing aids through voc rehab so that you can continue working.
Well, thank you very much for listening to us. I think we've got some time for questions. If there are any, we'd be happy to answer those.
So thank you so much. I love all that information about what somebody can do and sort of breaking it down. I had a question come in asking, can you reverse hearing loss if you catch it soon enough? Maybe if it's super mild.
That is a great question. Reversing hearing loss, I would say the general answer is no. Hearing loss is a bit unpredictable, and that's why we recommend monitoring it closely. There are certain types of hearing loss, like if you have a hearing loss due to an ear infection or earwax in your ear, that can be medically managed. We can clear out the earwax and then your hearing comes back, or we'll treat the underlying cause of that conductive or mixed hearing loss, and that can help reverse the hearing loss. Most often, something like a sensorineural hearing loss, once you have hearing loss, it's going to stay there. We can't reverse it. What we can do from then is monitor it closely with annual hearing tests, make sure that you're using hearing aids or any other resources for you, but we can't really reverse it. It is important to monitor. We don't know if or when it will change. You might have that hearing loss the same level for your whole life, or it might get worse either gradually or suddenly. Hearing aids can really help improve your communication, and so if you start wearing hearing aids soon into a hearing loss, you get used to it, you get used to that sound quality, and it's easier to adapt to those changes over time. And it just provides you more sound in your daily life, but we can't really reverse hearing loss usually.
Okay. Now, is it possible for both ears to have a different hearing issue?
It certainly is. Yeah, so the hearing loss that we showed earlier was very symmetrical. The ears were hearing at the same levels, but it certainly is possible to have a hearing loss that could be one type and a different type in the other. So say maybe you have a sensorineural hearing loss in one ear and then you have a mixed hearing loss in the other. So it's certainly possible to have hearing loss that are different types. And it's also possible to have hearing loss that is the same type, say sensorineural, but different degrees or severities of hearing loss. We often see something like that if there's been like exposure to firearms. Usually the ear opposite to which side you shoot with is going to be affected most. Anytime that we see that there is a difference or an asymmetry between the ears, you want to refer over to an ear, nose, and throat physician to determine what the reason for that is. And sometimes there really isn't a reason. Sometimes one ear was simply more sensitive to noise exposure than the other. But we always want to take the precaution to find out if there is a cause that we should be monitoring.
So in a case like that, where you might have two different levels of hearing loss, then are you able to then set those hearing aids to adjust accordingly?
Yes, so all hearing aids, essentially our audiogram is our prescription for the hearing aids. And so all hearing aids are prescribed to the individual patient and furthermore the individual ear. So hearing aids do not amplify equally all across. As you saw in that audiogram that had like a nice slope, we wouldn't really want to give you any volume in those low pitches where that person was hearing normal. We just want to amplify the areas that have a hearing loss. And so within the individual or across individuals, and then within the individual across the two different ears, we always prescribe the hearing aids accordingly. And one other important thing there is, Haley mentioned earlier, if you have a hearing loss, you should be having it tested once a year. Particularly if you have hearing aids, you should be following up once a year because that could be progressing or changing. And if that's the case, we want to make sure that we're adjusting your hearing aids accordingly so that they're amplifying appropriately.
Great. And I had one more question that came in, and they wanted to know what's the difference between an audiologist and a hearing instrument specialist?
Mm-hmm. Do you want to take that on, or should we both answer this one?
So an audiologist they have gone to grad school for audiology specifically. So it can be a master's degree. They've since switched within the last 15 years to a doctorate degree. So we both have our doctors of audiology, and they're going to look more medically at your whole hearing health. So we're looking at all of those things for when we should refer you to ear, nose, and throat physician to see if there's a medical condition that we're concerned about that you need to be medically evaluated for. We're looking at how well you're understanding speech. We're really kind of putting everything in a holistic health kind of view, and also working with your other physicians and making sure that we're taking your whole health into account when we do the hearing test. We're using all of that information to guide you towards potentially hearing aids or other amplification devices, communication strategies, the correct position you should go to. We're asking a lot of information about your whole health, and then we're prescribing those hearing aids based on that as well. Whereas a hearing instrument specialist is doing the hearing test to specifically program the hearing aids. So they're not necessarily going into all in depth of everything in your health history. They're looking to fit that hearing aid to your hearing loss, which is good, but the audiologist is going to look more in a global health part. We also work with patients with things like tinnitus or ringing in your ear to make sure that we are addressing those concerns, which a hearing instrument specialist won't be able to address in the same way. We work with people with auditory processing disorder to really help them understand the speech, not just have a hearing aid. We do monitoring in accordance with what your doctor recommends, and then audiologists are the only ones that can work with pediatric patients as well. So,
sorry, go ahead.
Yeah, so hearing instrument specialists are doing the hearing test to be able to give you a hearing aid and program to your hearing loss, whereas the audiologist is more looking at that whole health aspect.
Cochlear implants are also another aspect that hearing instrument specialists do not work with. It's only an audiologist. And generally, I think, it can vary from one state to another, but here in Arizona, usually you have someone who has a high school diploma and then goes through a licensing exam. So like Haley said, not really having all of that scientific background and understanding how the anatomy and the physiology of the ear works. So yeah, that's a great question.
Yeah, and whether you get your hearing aids from a hearing instrument specialist or from an audiologist, I do think it's worthwhile to get a hearing test from an audiologist specifically.
Great, thank you. Thank you for clarifying, because I'm sure people don't really know, oftentimes don't know, who they might be seeing. I had one last question just that came in, and that was about background noise. And why does it have to be so loud? So, I don't know, is there any reason that it comes through that way, or?
Well, I mean, I think it depends on the environment, right? Certainly there are some restaurants that are noisier than others. I do believe the Aloha website, and we've got that link listed in the community resources, they have a list of quieter restaurants. I think that was put together by people who have a hearing loss and we're looking for such places. So that's one place to look in. But yeah, I think it really depends on the situation that you're in. Unfortunately, even with hearing aids, I don't know if this is a question coming from someone with hearing aids or not, but unfortunately, even with hearing aids, oftentimes what happens is that the background noise is also speech, right? If you're in a restaurant, you're hearing people talking behind you, the waiters coming around, that sort of thing. And so with hearing aids, it's impossible for them to completely reduce the background noise because a hearing aid doesn't know the difference between speech that you want to hear in front of you and the speech that's going on around you. Certainly the algorithm is going to try and work to try and determine which speech is most important to you, but I think it also, we have to implement those communication strategies and think about sitting in an area that is well lit and that is set up for someone with, set up better, I suppose, for someone with a hearing loss.
Thank you. Yeah, that, I know that's such a challenge for everyone to have that background noise. I did want to just share one last time, if you have any questions regarding TMC audiology, please give them a call at 520-324-1055, and they'll provide you with any additional information. You do need a referral in order to see one of our audiologists, so keep that in mind, but any information that you want, they'll be able to help you with. So I want to thank you ladies so much for being here today. It was wonderful to have you. I look forward to seeing everyone again on Thursday, March 24th. We do have a stroke prevention talk on the signs and symptoms for stroke with Dr. Teeple, and that will be at 2 p.m. on Thursday, March 24th. Thank you so much for being here.
Thank you.
Thank you.